So I'm going to talk about HIV serostatus disclosure to sex partners and associated factors among high-risk MSM and transgender women in Lima. So HIV serostatus disclosure can inform sexual risk perception and sexual risk behavior within partnerships. And disclosure may be an important HIV prevention strategy, especially as newer biomedical interventions such as PrEP and treatment as prevention are rolled out. We explored disclosure among MSM and transgender women in Peru. These are the two key populations in our setting. So our study ethnographically recruited over 700 participants to assess the effectiveness of an 18-month community-level HIV prevention intervention. Unfortunately, the intervention was not successful, but we continue to look at the data. MSM and transgender women were enrolled if they reported being primarily attracted to men, were over the age of 18, and planned to be in the community for the duration of the study. Participants were asked about serostatus disclosure and sexual risk behavior at baseline and the 9 and 18-month visits. They also provided detailed sexual behavior data on their last 3 sex partners. At baseline, HIV status was based on self-report. It's the data we used, although participants were tested for HIV at baseline and during the follow-up. We defined disclosure as having told a sex partner about one's HIV status. So this was irrespective of whether or not the disclosure was an HIV negative status, an HIV unknown status, or an HIV positive status. We used GE models to explore disclosure at baseline to the last 3 sex partners, looking at the partnership level, and then longitudinally over the follow-up visits of the study at the individual level. At baseline, participants disclosed to 39% of their reported sex partners, and disclosure was lower among participants reporting an HIV positive status. With 27, they reported disclosing to 27% of their sex partners among HIV positives and 45% among those who reported being HIV negative. Looking at disclosure among those who were self-reported positives, outside of their disclosure to their sex partners, 80% did disclose their status to someone, primarily family or friends. The 8 people who reported being HIV positive who did not share the results with anybody, 60% said that they wanted to keep their results private, and 50% said that they didn't have anybody to share them with. So looking at the baseline data, again, this is primarily looking at the partnership level. Individuals who were HIV positive or of unknown HIV status were less likely to disclose. Having a partner disclose their status to them was the most influential factor in terms of disclosing. And the variables of length of relationship and type of relationship, although they were significant in the bivariate model, they were not significant once we adjusted for specifically partner disclosure status, partner having disclosed their status to the participant. So this is just the data without a table. The participants who were HIV positive or of unknown HIV status were less likely to disclose. The most influential factor for disclosure was having a sex partner who disclosed to the participant. And after adjustment for this factor, only participants' HIV status remained significantly associated with disclosure. We also stratified by whether or not the partner had shared their HIV status with the participant, and the results remained the same. Also looking at time from the last HIV test to disclosure, the vast majority of people were disclosing a recent HIV test result, although we did see that some people were reporting a result that was 1 to 5 years old or a result that was over 6 years old, and 11% were disclosing without having had a previous HIV test. When we look at disclosure over the course of follow-up, disclosure did not increase. So about 51% of participants disclosed at baseline to at least one sex partner, 49% at 9 months, and 42% at 18 months. Among the HIV positive participants, disclosure did increase during follow-up. So overall, at least 15% disclosed to at least one partner at baseline, and 26% disclosed to at least one partner at 9 and 18 months. The big jump is probably due to people finding out about their HIV status. 71% of the participants who were HIV positive at baseline, based on testing, were previously unaware of their status. So if we look at the results of disclosure over the course of follow-up, again, being HIV positive at baseline or being an incident, having an incident HIV infection over the course of follow-up were both associated with decreased disclosure. Here, the partner characteristics, having at least one stable partner, being with one partner for at least 2 years, and having a partner disclose their HIV status to the participant were all associated with increased disclosure over the course of follow-up. So again, disclosure was positively associated with at least one sex partner disclosing to the participant, and HIV positivity at baseline was negatively associated with disclosure during the course of the study. Incident HIV was negatively associated in the bivariate analysis, but it's a very small sample, so we didn't have power to see that in the multivariate. So high-risk MSM and transgender women disclosed to less than half of their sex partners. Being HIV positive or of unknown serostatus were both associated with less disclosure. And also, HIV serostatus disclosure information was often out of date. We should understand all of this in the context of there's criminalization in Peru of knowingly spreading HIV infection. There's also high levels of discrimination and stigma. There are also severe challenges to the logistics for HIV testing, and fear or negative experiences with healthcare personnel. People also report a lot of fear of their partner's reactions, both reactions of violence and of dissolution of the relationship. And we should also point out that we really do not know the content or quality of these disclosures. We actually thought that this was fairly high amount of disclosure, but we really don't know what those conversations were like, especially when we talk about having disclosed an HIV status that was out of date. It could be that people were disclosing exactly that information, that they had an HIV test years ago, but didn't really know their current status. When we look at this qualitatively, that does not seem to be the case. It seems to be that people are using older HIV testing to continually report themselves to their partners as negative, but that's something that we really do need to explore more. And also, a partner disclosing their serostatus was by far the most important factor, especially at baseline. In communication about HIV and serostatus within partnerships should be promoted, potentially along with or in the context of couples voluntary counseling and testing. We are currently conducting qualitative interviews with gay men, both individually and in couples, to explore if couples voluntary counseling and testing would work in this setting. I'd like to thank the study participants as well as all of the people who work with us and our funders. Thank you.